So my name is Darshan Mehta. I'm a general internal medicine physician based at Harvard Medical School. I am just a little bit of background on myself. I'm the medical director of the Benson-Henry Institute for Mind Body Medicine at Massachusetts General Hospital. I'm also the medical and education director for the Osher Center for Integrative Medicine at Brigham Women's Hospital, and I'm on faculty as assistant professor of medicine and psychiatry at Harvard Medical School. I guess there's several threads how I got to where I got to. I would say most notably my family and by extension my faith traditions have carried me here to do this work. In terms of how I self-identify, my family is Jain by background. I grew up in Chicago. My parents immigrated to Chicago. Between college and medical school, I deferred my admission to medical school for a year, and I spent a year at an ashram in India, and that was under the directorship of the Swadhyay movement, which was by it was revered. His name was Pandurang Shastri Atavale. He was the 1997 Templeton Prize winner at the time, and we were the first class of students at this ashram to come from the United States. It had been there for a couple of decades, but we were the guinea pig class of 10 students at that time that came. And that was really a transformative year for me. And the seeds that were planted then I think are coming to fruition today. Later on, when I finished my residency, I realized that I wanted to do fellowship, and I was very interested in complementary and integrative medicine practice, which is what brought me to Boston. I was on a research fellowship that focused on research in these modalities. And through that journey, I also learned that I didn't want to be a researcher. I loved research, I loved studying, but I'm not really cut out for the arduous process of grant writing that a lot of researchers have to do. There I got to work with now the late Dr. Herbert Benson, and he was certainly very influential because he had created this clinic model where we were bringing in mind-body medicine practice in the clinical setting. And it was just serendipitous. I happened to be a moonlighter for him at that time. I happened to meet him. So I had the trilogy of South Asian sort of traditions. You had Jain as sort of my birth, but then I grew up in sort of this Vedantic, and then was really influenced by Buddhist thought. And so I had all these, this amalgam of these different faith traditions in my life, and I really see myself fluid between all of these. And since then, I continue to do this work on the clinical side, but it also influences how I teach and what I teach. And I think every day, mind-body medicine is that intersectionality of faith and medicine. People are looking for a sense of relief. Many different themes emerge, right? So advancing health, relief of suffering, finding meaning and purpose, which I think is right at that intersection. So I think for me, every day is this engagement with faith and health. Even with patients, I think physicians are reluctant to go there, but in my line of work, I have to go there. Where do you find meaning and purpose in your life? Because part of that is when you don't have meaning and purpose, your stress response is elevated, and that results. I've found that is sort of the factor that contributes to poorer health outcomes. So we have to address these things, yeah. I think one positive story for me was this past year I helped co-chair the academic program in my field of integrative medicine. We have our annual meeting, and one of our keynote speakers was Ibu Patel. I'd invited him. And in some ways you think, in integrative medicine, discussions of interfaith dialogue should be natural, perhaps, but it was a new topic. And so that was a very positive, I was able to bring something new to the field in a way that we hadn't done so before. And I thought it was very powerful dialogue. I learned in that process, one of my colleagues openly ask a question in front of the entire audience or talk about her own lived experience of being of one faith in her childhood, but then later in life, being connected to another faith community, but she can't talk about it in the context of her other passion, which is she's an advocate in this person's case for medical marijuana, and so you had this sense of like, wow, what a powerful, like I just learned something about this person's life who I'd never seen as known that her faith community was so important to her. Just even that one example was to me very powerful. I think one of the challenges is to continue to create comfortable spaces like that where people feel vulnerable to share their dialogue, their story. People want to share their story. And I think the challenge will always be, are we creating those spaces? Separate from, obviously we create the space here, but do we create it elsewhere? And when we return back home after this.